Are you confused about progesterone therapy? In this video, let's talk about progesterone. What is it used for? What is some common dosing? And maybe some things that might actually surprise you about it. I'm Dr. Jen, welcome back to my channel. I teach a lot about how to thrive in midlife and longevity tips. I'm double boarded OB/GYN in integrative medicine. So let's dive into progesterone, and specifically progesterone used for hormone replacement therapy or menopause hormone therapy, depending on which term you use. So progesterone, what is progesterone? Progesterone is a natural hormone and is part of this symphony of hormones that we call sex hormones, which is estradiol, progesterone, and testosterone. There are actually three estrogens in the body, so estradiol, estriol, and estrone. And these particular sex hormones have to work synergistically together. And when you're young and still having cycles, progesterone is vital for having a normal menstrual cycle, for supporting a pregnancy, and helping with a lot of brain, heart, muscle health. But as you age and go into perimenopause, progesterone also still is very vital. And I want to talk about this because I find that a lot of providers do not prescribe progesterone if a woman has had a hysterectomy. And I really do disagree with this. I think that progesterone is incredibly important for a lot of different reasons, and it doesn't need to be reserved for just someone who has a uterus. There's a lot of really important reasons to use it. And so let's talk about how it can be important for you even if you've had a hysterectomy. So do I need progesterone? When menopause hits, progesterone and estrogen both decline. In fact, progesterone tends to decline first because you're not ovulating consistently every single month, and you need ovulation to occur to make adequate progesterone. And when that happens, women start to notice that they have difficulty sleeping, getting to sleep, staying asleep. They may have anxiety, may feel irritable, annoyed, apathy, may have heart palpitations, may have joint pain, or feeling like their muscles are really stiff, waking up stiff. In fact, you could even pull your neck muscle rolling out of bed. Not that it didn't happen to me, but you can actually literally injure yourself with things you're not even really thinking are going to hurt yourself. And that's because progesterone is really critical for multiple things. Here are some of the key benefits for progesterone. So it supports brain health by promoting neurotransmitters like GABA, which reduces anxiety and irritability. It helps skin elasticity and actually helps collagen production and overall good skin health. It promotes good heart function and relaxes the heart. It improves bone density and strength and also improves muscle. And it's really important for thyroid function. In fact, the conversion of T4 to T3 is often affected by thyroid, and some women even notice they develop a thyroid problem as they're going through perimenopause and menopause, which is a complete different topic. We should make a video on that specifically because that's really important to understand that sometimes this is actually related to changes in your sex hormones and not a decline of the thyroid gland itself. So when you talk about progesterone replacement, what are the dosings and delivery types? There's a difference between bioidentical progesterone and synthetic progestins. So bioidentical progesterone just means that the hormone progesterone that's in your body, you're literally replacing it with progesterone, just like you replace estradiol with estradiol or testosterone with testosterone, versus synthetic progestins, which are actually a laboratory derived progesterone that is not the exact same chemical structure as what's present in your body. Most women are familiar with synthetic progestins because that's what we use for birth control pills, but also commonly if you've stopped having your period sometime during your reproductive years, you might have been given a very common progestin called Provera, which is a great medication. It helps precipitate a period, helps you get that period, but it is considered a synthetic progestin. The data from the Women's Health Initiative, there was a concern for synthetic progestins, and so most of us who do menopause care try to use a bioidentical progesterone first, but there are some good options for progesterone in this category. So the combi patch is a combination of estrogen and synthetic progestin, and sometimes people have to use that because they find it easier just to have a one patch for everything. Or you could be using like Duvet, which is actually a prescription for a different type of progesterone, but it is a synthetic progestin. So there are options that can be used if the traditional bioidentical progesterone called Prometrium from a brand name is not tolerable for any reason. So let's talk about that. particular thing. So Prometrium is the brand name. Progesterone is the active ingredient. Prometrium is given at night because most people, it helps sleep. In fact, the oral preparations of progesterone are best for women who have a hard time getting to sleep and staying asleep. And typically you're going to take it 30 minutes to an hour before you go to bed. If you find it makes you too drowsy or you don't feel very good with it, you can actually even back it up earlier to that and take it 8 or 9 p.m. It comes in multiple doses. It can come in a 100 milligram, 200 milligram, or 300 milligram option. And obviously if you did compounding because you don't tolerate those doses, then you can make essentially any dose that you want for progesterone. There also is topical progesterone. Now the data with whether or not it protects the uterus is not as strong as with the oral progesterone. So you do have to be careful if you do have a uterus that you're taking the appropriate dosing and that you're paying attention to the safety profiles of using transdermal progesterone in a cream form, not the patch specifically, because the FDA approved patch called Combi Patch has been studied and is appropriately dosed in that way. So right now you essentially have 3 choices. You have the oral option, the patch option, or the cream option. So it's something you need to speak with your provider to try to find out what is the right mix for you and how you feel. We often will make a decision based upon how someone tolerates the medication and also what makes sense for you to remember to use. So the best type of progesterone is really, it depends on you. So the ease of use of using it, the cost, what makes sense for you and your provider as far as the safety of the medication. The last thing I want to say is progesterone works great with estradiol, meaning they are a team, and so they work synergistically together. I rarely prescribe progesterone without estradiol unless someone's early in perimenopause and they really only need progesterone initially, but oftentimes it's a dynamic duo that works great together. If you found this video very helpful, please like and subscribe and share this with your other women friends who might be suffering and struggling with what to choose for hormone replacement therapy, or even just want more information about how to thrive in midlife. Thank you.